The individualists know that 80% of pharmaceutical sales come from blockbuster drugs pushed harder on the public than any street dealer of illicit drugs for only the survival of hypochondriacs. The nation will not assist the support of needless dependence. No pharmaceuticals are supplied by the Populus funds, else this leeching industry would exploit the program, skyrocketing the cost and cause the system to fail. As such, fewer drugs will be purchased, being that the individuals will have to bear the full cost themselves. This will assist the practice of individualistic health, causing the people to become more aware of the resilience of the body without synthetic chemicals, causing the pharmaceutical industry to lower prices and turn to more natural solutions to maintain business. Various miscellaneous care is considered non-vital and of private interest. Of all of these and similar categories, chiropractic care is the only one recognized by the individualist as a vital practice and encouraged for its near-endless curative and preventative techniques. However, it is too often exploited for dubious insurance claims and must therefore remain private. Non-traditional spending is mostly misused, mismanaged, and misdirected tax money to be dismantled and integrated into the one orderly system of individualistic care. Industrial services must remain private choice. There will be no lending of public funds to private researchers. Government lending to private research is thoroughly compromised. It is also a violation of individualistic precepts to allow any form of government assistance. Thus, all necessary public research will be conducted at the populace's direction with the amount that they alone specify. All government agencies involved in healthcare are dismantled and organized into one efficient body of the populous health system. Notes: 1. 309 billion of this 568 billion is publicly funded, tax. 2. The selling of any type of insurance is forbidden in the individualistic society, thus all the above labeled private will be paid for totally out of the pocket of the purchaser. Reasonable expenses: 421 billion in physician and clinical services, salaries, etc. 58 billion in medical equipment. 438 billion in hospital care, less administration and profits. Note: the above three prices are most likely inflated to hide additional private profits. 20 billion in public structures, totaling 929 billion. 151 billion of this is publicly funded tax. Summary: 761 billion in expenditures are immediately removed by implementing the populous health system. 88 billion is now towards public health structures and equipment as permanent assets of the public. This amount is expected to drop substantially after the first year, for construction has always been an excellent outlet to hide profits and inflate expenses. 109 billion is reorganized inefficient departments of the old world into a new centralized management. 909 billion remains virtually in the same use, but under more efficient monitoring and management of the populous health system. Know that this does not include the spending of these private entities on extraneous costs such as marketing, which for the health industry alone is over $1.6 billion. The populous health system would therefore be, at most, a $1.227 trillion plan. That is 1.988 trillion minus 761 billion equals the 1.227 trillion. With the workforce already presently paying 903 billion in the form of their taxes allocated to government health programs and 197 billion in out-of-pocket expenses, a mere additional 127 billion needs to be spread upon the 150 million adult workers of the workforce, amounting to a flat tax fee of no more than $847 per year, which could be temporarily implemented while transitioning to a fully individualistic system. By removing 2.54% from federal taxes and allocating them to health instead, this 127 billion plus the 197 billion in out-of-pocket expenses are both covered. Therefore, the system will not even require out-of-pocket expenses. 197 plus 127 is 324 billion, which is 2.54% of the 2005 gross domestic product of $12.8 trillion. such as the origin of the 2.54% used. Being that the individualistic society encourages self-sufficiency and may lead to a drop in available workers, the workforce alone cannot be considered. The individualists remove all health-related taxes and consolidate them into one fee. The tax's final form is a non-income-based flat fee divided equally per capita of $4,090 for each individual, or $8,180 divided over just the workforce as it is presently, creating an average $5,073 health burden relief per labor force worker. That would be $13,253 minus the $8,180. Legislation shall be passed forbidding tax spending on healthcare except with strictly this flat tax for paying members of the system. The tax credit received from the lower flat income tax of the individualistic society will make more capital available to these working individuals, making the relative burdens on average $6,501 less than the privately insured workers previously paid, 63% of the workforce, and $847 more than what the publicly insured paid, 37% of the workforce. These payments by this working half of the population support themselves and the other half of society, the children, the elderly, and the disabled, just as they do today. Note, a $143 billion deviation is found in data regarding the amount spent in premiums on private insurance and the amount of revenue taken in by the private insurance industry. Due to the rounding in this document, the error only seems to be $121 billion. No one is forced to pay the flat fee for healthcare, even though at its low cost it would be foolish to do so. In the event that an uninsured individual is harmed and care administered by a Populus facility, it will be viewed as though a loan was taken from the Populus funds, and therefore needs repaid within 5 years, as any other loan. Else, one is sentenced to a labor force assignment. This fee will most likely drop each year as individualistic philosophy takes root and corruption subsides under the pressure. The individualistic system will be evaluated each year for cost and its price adjusted accordingly to the people's desire. With individualistic philosophy, the population will become increasingly healthier as they realize the strength and resilience of nature, for millions of years not needing any drugs, therapies, supplements, etc. Following the simple health methods of the individualist, page 150, the people will most likely only use healthcare for sheer accidents. The sole reason why the healthcare costs are high and rising is because of the lack of preventative care and basic health practices such as hygiene, exercise, and diet, as well as the countless exploitations of ignorant hypochondriacs created by the mass marketing of health problems and products. The majority of the U.S. now exists as a nation of ignorant, lazy, and out-of-shape weaklings who are thoroughly unhappy, all contributing to increased health problems. Over 65% of the population of the U.S. is overweight. The NCHC suggests that retiring elderly couples will need $200,000 in savings just to pay for the most basic medical coverage. This is simply because of the weakness created and encouraged by the current system and dependence upon it and synthetics as opposed to self-health practices. The individualistic elders will be strong up to the moment of death and will need very little, if any, assistance when aged. C. The quality of individualistic care. As one may notice, the amount of physicians and their salaries was not altered in the conversion to individualism. Thus, there is no threat to doctors or the quality of care they provide. However, as individualistic thought grows, the profit-driven doctors, with more feeling for the size of their bottom line than for the love of the occupation they choose, will fade away with the increasing popularity of the individualistic doctors displaying true love of healing and compassion for their fellow man. The salaries of individual doctors, as all Populus employees, will be based upon their performance. Too often, guaranteed high salaries cause people to become doctors, or any other occupation, for the money instead of for the love of what they do. The individualist does not disagree with the right to earn a high salary, but it must be granted to a worthy recipient of a public-funded system by popular vote. Thus, each patient must fill out a form after receiving care and mail it to the GEP, evaluating their care on a point-based system. Each year, the points are totaled, and a subsequent raise or demotion is given to each Populus health facility and to each individual employee from doctors to janitors according to the points which they earned. Thus, these health workers will always remember that they are employees of the people that they are serving. Therefore, a truly excellent healer, known nationwide in the individualistic society, could possibly command a salary much higher than the present average doctor salaries of $156,000 to $321,000. Note: a fee-per-visit system encourages haste within doctors, as more patients seen per day equals more money, leading to poor care. If the fee was $50 and one patient was seen every 15 minutes for 10 hours a day, 5 days a week, this doctor's salary would be $520,000 per year, over twice the present mean average doctor salary. It is no wonder why some doctors support this option. D. Quality of present care. The individualists believe that many modern hospitals are money-making machines and nothing else, far removed from places of healing. Facilities where death is suspended for profit, such as when an individual arrives brain dead from a massive heart attack. Many doctors see nothing but dollars. They perform quote-unquote emergency surgery and sustain the body on a myriad of machines, each charging by the hour. They fill the corpse with expensive quote-unquote medicines while conducting expensive tests with more sophisticated machines, each costing ridiculous amounts. This is dragged on for days, weeks, as long as possible, giving a family false hopes while feverishly writing the bills to the insurance company, accounting for every second and penny. Individuals entering these doors are potential experiments, guinea pigs for a host of their practices and endless horror. Hypochondria is nursed and encouraged. The more fear instilled into a soul, the more that soul will place all trust in the doctor instead of God and self-healing. This is used to the advantage of their pockets by placing these people on countless drugs, tests, and surgeries, killing, poisoning, maiming, and mutilating their fellow brethren for income in the blasphemous guise of healing. Many surgeons have become masters of mutilation, filling men with pins and plates, replacing and removing body parts as if it were a fad, ignorant to the infinite complexity of the self-healing divine machine, the human body, while asserting in arrogance that they comprehend in detail this work of God. Thus they proceed in blindness with great conviction, and their conviction becomes contagion when spoken of with certainty to quote-unquote lesser men, which only succeeds in compounding the ignorance of man. Thus, they continue treating the effects of disease rather than their source, disregarding wholly the factor of spirit in their equations. Thus, much of healthcare is naught but an unprovable racket, for an individual with no degree in medicine cannot hold an argument against any doctor and be believed, even if in the right. Thus, a doctor will win every argument regardless of his ignorance. Society hands them a pedestal with their degree, and often look to them as all-knowing. Instead of looking into one's own heart or to God for answers, they consult a doctor, which is just another soul. These doctors exploit this ignorance and trust of these patients in the guise of benevolence and use them for their advantage. Even if they know a simple, natural, and safe cure, they prescribe procedures and endless pills to elevate their profit and that of their contributing industries, the pharmaceutical industry, medical manufacturers, etc. Such are the countless numbers placed on chemotherapy, not but a poison, and most likely responsible for more deaths than cancer. Of the $590 billion in hospital care, how many emergencies have been feigned for insurance money? How much money goes into each childbirth when the Indians had them in fields? How much special care is feigned for newborns? How many are taking drugs or scheduled for a procedure that could merely be prescribed a regime of exercise and diet? The individualists believe it to be substantial and will remedy great amounts of people and expenses with simple self-health care methods. Page 150.